What is up, everybody? It's your boy Red X Black, and I am back with another video. And I have this interesting story out of Australia. Now, I am not an anti-vaxxer in the least, I promise you, but I understand why people have so many questions and so much skepticism behind vaccinations. And case in point, something like this. So people in Australia, in these trials, people had false positive HIV results. False positive HIV results. Let me read. This is just the Kaiser Health news. It's just naming off the sources from where this came from, so it's not a full article. It said an Australian produced coronavirus vaccine candidate has been scrapped after trial participants returned false positive test results for HIV. Developers announced Friday the inoculation, which had yet to progress beyond phase 1 trials, was being jointly developed by University of Queensland and Australia Biotech. Company CSL in Australia had hoped the vaccine would be available by mid-2021. And also down here, let me see. Where did it say it at? Oh yeah, it says the vaccine had elicited a robust immune response to the novel SARS-CoV-2 virus, also known as COVID-19, without serious adverse effects in phase 1 trials, with 216 participants re-engineering a fix to take another 12 months. Okay, that was worded weird. They said. So apparently the vaccine worked, or it elicited the immune response that they wanted, but they scrapped the program because it couldn't get past phase 1. And on top of that, people were testing positive for HIV, falsely positive. That doesn't mean that they had the virus, but I think the immune response that would, I don't know, the response that you would get from being infected with HIV was, I guess it was similar, or maybe antigens were similar and it was picked up in the HIV test. I'm not sure. I'm not a scientist. I know these people are working hard and trying hard with this. And I really think the public health messaging needs to be better, and there needs to be a lot more transparency about what's being put in there, how it's being developed. They've been warning people about the side effects, but it's like already at a point where people already think that you're going to grow a third arm if you take this vaccine. So just different things like that. And then also a few minutes ago, I just heard about the Moderna trial, one of the Moderna trial vaccination trials. Some people were two or three people had developed a Bell's palsy, which is a muscular disease, and I'm not sure if that's because of the virus. I mean, not because of the virus, because of the vaccine, or because of just maybe it was just coincidence. But that's something else that's taken into account. And it's just, those things are just concerning, to say the least, that these things are going on with these vaccinations, because we're testing this stuff on people, and we're all supposed to take this if we want to end this pandemic. And it's just causing more distrust and more confusion and fear, really. And on top of that, because of past experiences for some communities, like the Tuskegee Airmen were, I think it was a measles experiment that they did on them. I forgot what it was. It was the Tuskegee. You can go look it up. The Tuskegee, the Tuskegee experiment. And so things like that have just caused distrust over the years when it comes to anything medical, vaccination, medicine, anything like that. So yeah, this is kind of concerning that people were tested positive for HIV after that, because now I've seen even people on Facebook, as soon as this news broke about this, all of a sudden people were saying the vaccine is going to give you AIDS, guys. It's going to give you AIDS. It's going to give you this. It's going to give you that. And they're not doing a good job of like, hey guys, no, calm down. Look, we'll explain why this happened, how this happened. And the people who say that, it's usually their voices aren't loud enough. It's not constantly hammered out there. It's just like, hey, this happened, this is how it happened, and they move on. And then the rest of it is just, hey, trust us. We're the experts. Trust the experts. The media, especially, just trust the experts. Trust the science. They're doing this. They're doing that. Well, people have questions, guys. People have a lot of questions. So, yeah, that was pretty concerning. But I don't think that there's been any other issues such as that, like HIV or anything else like that, in any other vaccine trials that I know of at the moment. But yes, there are adverse reactions to the vaccinations, and over time, I think that they'll work that out. I know it kind of sounds bad. It's like a console, a gaming console. We'll work out the bugs as we go along, but we're humans, okay? We're not gaming consoles. So hopefully they can work this out before it becomes a broader problem and before it can cause any, broader issues. But yeah, so that's all I got for this one. Be sure to like, comment, subscribe, like, comment, subscribe, like, whenever do it, however do it, wherever do it, just do it. It's your boy Red X Black, and I'm out. Peace.